All right, and we are here with Dr. Dina Kulik for another episode of the Lowdown. Dr. Dina is a pediatrician. She's an emergency room doctor at Sick Kids. You are, I believe, the founder of Kidcrew, I believe, the clinic with all different types of healthcare specialties dealing with pediatrics. Is there anything else we should know about you?
Yeah, I'm a mom of four. Yes, I'm a pediatrician, a pediatric emergency medicine doctor, and I do have 4 kids. Yeah.
Oh, great. I only have one right now. He's 15 months old, and that's a lot of work. So I can imagine what 4 is like. So
It's a lot more work than one, though 15 months is a hard age. So that's a
it
challenging
is.
time too.
It is a
Yeah.
hard age. It's been,
Yeah.
especially right now, which he was in daycare before this, and my wife and I are both at home now, and so trying to work and take care of a baby is not an easy thing. I mean, I can't overstate that. And you might I think people would have thought, it can't be that bad, but it can be a lot of work, but it's fun. We are getting to cherish a lot of memories that maybe we would have otherwise missed out on. So maybe some silver lining there.
Yeah.
Thank you for joining us today. I think one of the important things one of the silver linings with COVID is thankfully it doesn't seem to affect kids all that much in most cases. And I'll let you go on to maybe the cases where it might or might not. Why do we know anything based on the literature that's coming out, or just based on your theoretical stuff as a pediatrician as to why that might be the case? What sort of insight can you give people? Because I mean, again, thankfully it doesn't, but it's interesting to note that it doesn't. And so as a professional, I sort of sit here and wonder, well, what are those things that are unique maybe or different in children? So any insight that you have would be appreciated.
Yeah, so we're learning more and more every day. COVID is novel, right? And so literally every single day we're finding out more details. It's only been in Canada for a few months. What we know, and again, learning every day, is that COVID seems to cause inflammation or irritation inside the vessel walls. So we think one of the reasons why adults and people that have like chronic heart conditions or kidney disorders or previous strokes or high blood pressure or diabetes, these people tend to have more weakened vessel walls. We call it endothelial dysfunction. And the thought is that COVID is triggering further inflammation of the vessels. So kids, by and large, have very healthy vessels. They don't tend to have any endothelial issues. So it's not causing as much illness or really any illness in some children. Many kids are completely asymptomatic or have very mild symptoms, whereas people that have high blood pressure, diabetes, chronic heart problems, they're having more significant illness by and large.
Okay, and I think that's great information. What is I mean, a lot of kids obviously schools are closed, pretty much, I guess 90% of the world, schools are out. I follow very closely Mike Osterholm, who's an epidemiologist from the University of Minnesota, from CIDRAP. And one of the things that he's often spoken about is that there's not a lot of evidence for children not being in schools. And one of his concerns is when kids aren't in schools, parents can't, and parents that might be frontline healthcare workers can't go to work. And now obviously in Ontario, we've done a better job with that because we do have daycare centers open. But he seems to think, and based on his research, he doesn't just think it, that there really is not a lot of evidence to suggest that not having children in schools is stopping the spread. Do you have any? I'm not agreeing or disagreeing with that. It's just someone that I seem to follow very closely as an authority with COVID-19, and that seems to be his consistent message.
Yeah, so there was actually a study that was not peer-reviewed, but announced last week from Australia, where they looked at 9 kids with confirmed COVID and 9 adults with confirmed COVID, and they looked at about 900 close contacts of those people and kind of backtracked. And no one seems to have gotten COVID from those 9 kids that had it, but some people got it from the 9 adults that had COVID. But here's the thing. We know that kids are either not getting COVID or they're not having as significant symptoms. Most are probably completely asymptomatic. We also know that the testing is not perfect. It has a huge false negative rate, meaning kids and adults can have COVID, and yet their testing will be negative. So we can't really rely on it to tell, who's passing it to who. But certainly this was optimistic that these 9 kids didn't seem to pass it to anyone else. And there's a few reasons for that. A, they may not have a lot of symptoms, and therefore probably the reason for that, again, along the vessel wall inflammation theory is also that if you don't get very sick with it, you're not likely to have a lot of virus that you're shedding. That's called a viral load. So if you have a very low viral load, it's less easy to pass that on to other people because you don't want that much virus kind of coming out of you. And kids don't typically have a lot of respiratory symptoms either. So if you're not coughing or sneezing or having droplets leaving your face, your mouth, and your nose, you're again less likely to pass it on to others. Going back to school, yes, kids are not getting so sick with it. Yes, kids are not getting it that much. But there are, of course, adults that are in schools, right? So there's teachers and there's custodians and there's admin staff and there's kitchen staff and bus drivers and all of these various adults. Even if a child's not very sick, that doesn't preclude them from passing it on, we think.
Right.
And therefore, some of these adults are more at risk of getting sick. And then because we're all kind of moving around the environment, then theoretically, adults are going to go back to work. I mean, that's part of the reason to get kids back in school. We're just going to have more intermingling again. And I worry that some of the adults that work in these schools or their family members or friends will get sick. And I worry that we're going to start having, increasing numbers in kids again. I mean, we'll see. It's all very new. We all want to get back to work and get back to school. And my kids want to go to camp. I do want all that. But I also worry that we'll have like a similar thing happen like in the 1918 flu epidemic,
Right.
where we had, one, peak, and then people went right back to work and things. And then we had a bigger peak second go around. And to have that happen and undo these 3 or 4 months of, quarantine and all of that's done for us emotionally, financially, et cetera, to go back again and repeat all of that in the middle of the summer would be devastating.
Yeah.
So that's my thought. I think we should be patient and cautious. I'm not saying we shouldn't go back to schools, but I wouldn't be pushing for schools in areas where there's still a lot of cases or the mortality rate is still high.
Yeah. Yeah. And I mean, just outside of me being a healthcare professional, I think as a parent, I feel more comfortable right now with my son at home, not interacting at daycare. So I think it totally makes sense. I think one of the things that you mentioned there that I think is important for listeners to sort of appreciate, and you and I understand this as professionals, but the amount of research that is coming out around COVID, there's a lot of it. A big problem with that is, like you mentioned there, a lot of it's not peer reviewed. And I guess the average person doesn't understand how important that is, because research is really about, you have to be able to replicate things over and over again. So that way we can actually show that, hey, this is research. So I often talk about, it's funny when you hear people say, I've done some research. It's like, well, what does that mean? And they're like, yeah, I went on Google and I did some research. It's like, well, you did maybe some investigating, like you did something, you did not do research. Research is a very, very different thing. And the process of, blinded trials and it being fully randomized. Another point you brought up is that sample size in that study is very, very small. We don't want to generalize, the population of the world based on 9 adults and 9 kids. So I think that peer reviewed aspect is really important. Is there anything you'd like to add on that?
Well, also around the Australia group, Australia has not been hit the way that US and Canada and many other countries have. They've had a very relatively low case rate, a very low mortality rate compared to other westernized countries. Part of it might be that they did a better job of separating themselves. They didn't really, though. I mean, they didn't close schools like we did, et cetera. It's also not flu season for them. And there's some thought that if you're in flu season, which they, of course, are going into in the summer, that for some reason predisposes to more significant illness. So they might have a rise in cases. I hope not. They might have a rise of cases in June, July, August. We'll see. That would be interesting if it did, because that might explain why some countries like Canada, US were hit so hard over, the winter and the spring versus other countries that are in the Southern Hemisphere.
Right. Another point that you brought up, which I think is again brilliant and very important, is we're a lot of people are sacrificing a lot of things right now. Everybody almost in one way or another. And there's a big rush where people just sort of want to get back to their normal lives. They want to do all these things. But I think what you brought up there about 1918, where all of a sudden you can sort of undo everything and we can go back to a place, that is not necessarily where we want to be, because then we're potentially stuck in this again. And just from an example, like in my life, I've talked to a few people who, in terms of social distancing, they've actually been, in the beginning, they were very hard on this. They weren't going to see. And as I speak to more people, they're, oh yeah, I was at my mom's house and I was doing this, and I'm sitting there like, what? and it sort of drives me crazy to some extent, because I'm of the same mindset as you. We are all making a sacrifice here. Even if you're 100% confident that you're not sick, you don't know for sure. And because you don't know for sure, you're potentially putting people at risk. But if everybody, the problem is if everybody thinks that way, then we just get back into the mess that we were in. And all of a sudden cases start to rise and we're back to where we sort of were. Have you noticed a similar trend by, yeah, right? Okay.
I mean, even from the beginning, I had friends whose kids were having play dates early on.
Yeah.
I have, some of my kids' friends are having study dates even now, and that's so unnecessary. My eldest kid is in grade 4. Even just walking outside, even, coming home from work, like there's plenty of people that I'm sure not in the same family, 4 or 5 adult women that are all the same age. I think it's unlikely they all live in the same home. A
Right.
lot of people are mixing, and they have been, not just because
Yeah.
it's nice outside, but ongoing because people don't think that they're at risk. And again, because most people are staying healthy very well. That being said, in Toronto, like here where I live, there are 30-year-olds that are intubated in the hospitals here.
Mm.
There are otherwise healthy people that have no chronic health concerns that are intubated and fighting for their lives. This does affect healthy young people. It does. You may not know someone that it does, but over time, we're going to hear about more and more people that have died as young, healthy people. And also, we shouldn't be minimizing this illness because it's only affecting older people or
Yeah.
people with health concerns.
Yeah.
What kind of society do we live in? We're like, oh, it's no big deal. They're elderly. What is that? Like,
Yeah.
your parents, my grandparents, these are the people that are most at risk. I don't want a whole bunch
Yeah.
of grandparents to die. So this no big deal, we're healthy, otherwise young people. I don't know, that's not how I think our society should be functioning.
Yeah, and again, that's another point that sort of hits home with some of the things I've heard when in speaking with people, and people say things, yeah, but the majority of deaths are at nursing home, or the majority of deaths are people who have other. It's like, yeah, but this is not just a number. I mean, we talk about 200,000 deaths around the world. That's 200,000 people that were fathers, mothers, brothers, sisters, husbands, wives, children, whatever it may be.
Yeah.
These are human lives that are lost. And I agree with you. I have a mother who is otherwise healthy, except for she has some COPD, which but for the listeners is a lung condition. And so when I've been, like I've seen her a few times, but we've at the front of the driveway and I've kept my distance because for me, that's my mom's life. Like I feel fine. My wife feels fine. My kid feels fine, but I'm not taking that risk because in someone like that, that's a big problem. So yeah, I think that's another point that hits home. We can't minimize lives and to say this is just, well, this is an old person or this is someone who was otherwise sick. It's like, well, that doesn't mean it should be a death sentence,
And it's
right?
not
Like,
even everyone. I mean, there
yeah,
are lots of young, healthy grandparents. And there are 30-year-old healthy people that are literally on death's door in Toronto,
yeah,
where they have all the access to all the healthcare they can have. And again, they're well, healthy people. So it's not only affecting those people, but even if it was, why are we minimizing the importance of that and how valuable those lives are?
of course. Yeah, I totally agree with that. As a pediatrician, are there any cases where kids would be more at risk that you can think of, or that have maybe been
The,
shown in the literature?
No, I
No.
mean, theoretically, people that have chronic heart concerns, health concerns, otherwise, lungs, kidney, heart, but it hasn't really shown that to be the case, right? So, it's a mishmash of people that have gotten ill. There's been very few deaths reported even in the world of young people that have died. None in Canada that I'm aware of, not aware of any, or not many anyway, in the United States. Certainly there have been some around the world, but of so many cases, very few are children. So theoretically, the same issues, kidney, heart, lungs, brain, but that hasn't really been the case. People that are immunocompromised, people that are immunotherapy, chemotherapy, transplants, these kids seem to be doing just fine or not even getting it. But again, the testing's imperfect. So
Right.
who has it, who doesn't? You have symptoms, you don't have symptoms. I still think everyone should assume that every single person they come in contact has COVID.
Right. Yeah, and I think that's a very safe way of looking at things. If you always assume that someone has COVID, that's an important thing. Um, I want to talk about vaccines in a second, but one thing that I think is an interesting thing, and I've spoken to Michael Tabulo, who's the Minister of Mental Health and Addictions, and one of the things that that we've spoken about is that the idea of social distancing, right, is a very dangerous thing when in terms of that word social distancing. And he likes to really say physical distancing because the idea is you shouldn't be close to another human that doesn't otherwise live in your house, but you can be still being social with people. I mean, I was outside today with a friend who was 6 or 7 meters away from me, and we were just talking, and I in fact burned my face, as you could probably see from being out in the sun. But you know, I think that's important, and I think that's an important thing, especially with children. And that's where I wanted to really get your opinion. Like, I see my nieces, my nephews who are older than my son, who are, you know, sort of understand what's going on, and I could see it's taken a toll on them. The idea of not being around their friends, not being at school, they also can't really appreciate the severity of all of this. So for them, it's just like all of a sudden I stopped going to school and I stopped seeing people. What the heck's going on? Any recommendations around the sort of the mental health for young people?
Yeah. So, I mean, as much as you can, you want to continue to socialize your children. We're lucky. I have 4 children. So we have this kind of mini daycare happening
Yeah.
anyway, by nature of having a bunch of kids. And I'm very thankful for it. You know, it's
Yeah,
also
yeah,
more work, of course, we're educating and
yeah.
entertaining our kids, but they can play together. And that's like a huge blessing at the moment.
That's
I
awesome.
feel, you know, it's a difficult situation to have a young toddler who doesn't have playmates, right?
Yeah.
That's a challenge. I actually think probably 15 months old to 2 years, single child at home, 2 working parents. That's like a very difficult situation for people. But also young people, I mean, it depends how young they are, right? I
Yeah.
mean, you know, if I send my, you know, 9-year-old outside to play with his friend, he knows to keep a distance. I can explain that. He can
Right.
understand that. My 2-year-old for sure would not understand that.
Yeah,
Like,
of
he'd run up to
course.
his friend and give his
Yeah.
friend a hug. So
Yeah.
that's the challenge. And that's also a challenge I have about the concept of going back to school and daycare.
Mm,
We might send them back. We can maintain our distance, sort of. But how are you going to explain to the 2-year-old that they can't go and touch a toy that
right.
your friend touched or go play with their friend? In some ways, I feel like that's more mentally stressing for them. Like, I
Yeah.
don't want them to go and be like, oh, I can't touch people. I can't see them. I can't, like, there's just that's, I think, going to be a huge challenge for the very young kids. I mean, certainly older kids, high schoolers, etc., much less concerned. They understand it, sort of. I mean, there's a bunch of teenagers
Yeah.
playing basketball when we were taking our dogs for a walk earlier. Like, they were doing it then, they're still doing it. That is concerning for me.
Right.
And then you know, you're 7 meters away from your friend. At one point, does it become a little bit closer, a little bit closer? I think people are getting lax, as you mentioned
Mm,
before.
yeah.
So yeah, I mean, as much as they can remain social, I do have a lot of concerns, though, that kids, in the effort to be social, are spending an awful lot of time on screens.
Mm,
They're doing education on
yeah.
screens. They're doing entertainment on screens. They're home all day. A lot of parents are working. So a lot of kids are getting way more screen time than they should be getting. And in some ways it's helpful socially, and in a lot of ways it very much is not okay socially. You know,
Right.
like social media, too much screen time watching shows or even doing schooling, we know is really not good for your social well-being, IQ, social intelligence, behavior, sleep, eating, obesity, vitamin D levels, like a million different things. And
Yeah.
obviously we're in a different kind of time, but I still think we should be cautious about screens. It may not be helping your child's mental health. It may be taking away from their mental health.
Is there a recommendation that you have in terms of time? I mean, the reality is they're going to be in front of a screen at some point, right? But I don't think you're suggesting not to do it. I think you're suggesting minimize it. I know that I've always recommended at the very least a few hours leading up to bed, especially for sleep. I'm a big fan of Matthew Walker, who wrote a book called Why We Sleep, and he speaks a lot about this, giving yourself time at the end. He's a PhD and he studies sleep. Any recommendation for kids in terms of guidelines for parents? Like, what is something that is probably more acceptable, and you know, where you start to cross into a threshold where that's probably a little too much?
Yeah, I mean, so the guidelines are pretty clear from both the Canadian Pediatric Society, the American Academy of Pediatrics, really around the world. Kids less than 2 should not get any screen time other
Right.
than, some kind of device to talk to family members, like socially, but for a brief period of time. Kids less than 2 really should not be getting any screen. And I still think that kids, even now, that are less than 2 should not get any screen. It tends to cause a lot more behavioral issues. Again, poor sleep, a lot of issues that way. Kids 2 to 5 should get no more than 1 hour of screen time a day, and kids more than 5 should get 2 hours at a maximum. This is a challenge. I mean, my own,
Yeah.
7 and 9-year-old have 2 or 3 hours of screen time a day for school. But to be honest, that's all they're getting.
Yeah.
They're not getting any other social kind of screen time. They're not watching their favorite shows. During the week, this is what they're getting. This is the screen time. That's all they get. It's more than I want, to be honest.
Yeah.
And to your point, no screen time within 2 hours of bedtime. So the
Right.
reason for that is a couple things. One, it tends to delay bedtime, but also when you watch a screen, your melatonin, the brain chemical that puts you to sleep, is decreased.
Yeah.
So without you even trying to, you are decreasing the chemical that would make you sleepy. So a lot of kids are watching screen, a lot of adults too, they watch screens in
Yeah.
bed.
Yeah.
That could really cause impairments in terms of falling asleep and staying asleep and having good quality of sleep.
Yeah.
So as much as you can, I want you to limit it. A lot of families, this is a daily conversation, say, but how can I limit it? Like, what am I supposed to do with my kid? I'm trying to work full time. My partner's trying to work full time. How do I entertain them? A million other ways. My 2-year-old's not getting screen right now, by and large. He's playing independently. He's drawing. He's reading books. He's making Lego. He's playing with his trains. I find often when you start to give the screen, it becomes this addiction that just feeds and feeds and feeds. You try to take it away. They have a meltdown. You give them more screen to stop the meltdown, and it feeds into itself. Oftentimes, to have 0 is easier than having any in the very young kids.
Right. And when you say screen, that includes television?
Everything, TV,
Everything.
iPad, any device, computers, any screen.
Any screen. Yeah, I think that's a great point. One of the topics that I mentioned that I really wanted to speak about, because I'm an advocate for vaccinations, and one of the things I speak about on my radio show a lot is, there's a big anti-vaccination movement, and I've previously said, I don't think people understand the luxury we have by having vaccinations, and I've said this for years. And I've given the example previously of other third world countries that don't have that luxury, that, we don't have to worry about our kids getting measles, mumps, all these things, even though now, because of some things, we're seeing some resurgence. But in certain parts of the world where vaccinations are not widespread, there's thousands of kids and potentially tens of thousands dying from things that are very, very preventable. And I've always said, like, as a society in the Western world, and I've said this for a lot of things, but specifically for vaccinations, we've come so far that we get to a point where we forget. And because we forget, we have this luxury that now all of a sudden you could sit there and you can question everything. You can say, well, is there really a benefit? Is there this? Is there that? And it's like, this, unfortunately, shows us how much of a benefit it is, because I can almost guarantee you that if there was a vaccination, 99% of the population would be getting it right now, because they want to just get back to normal. They see the consequences of not having something that because that's the difference, is a vaccine is a tool for prevention. It's not just treatment. It's about never even being in the mess to begin with. I'm sure as a pediatrician, you hear this from parents a lot, that there's a concern around vaccinations for their children. I mean, I know that any science that's ever suggested it was harmful or whatever is bogus. There is no research to suggest that it's negative, only research to suggest it's positive. It's done great things by eradicating diseases. What's your opinion on all this? Obviously, I know you're pro-vaccination, but in terms of sort of I don't know, maybe an awakening, whatever we want to call it.
Yeah, so I mean, unfortunately, people have concerns around injecting their child with something, and I get that. I do absolutely get that, because it feels creepy. I mean, as a mom who has 4 kids who are fully vaccinated, it seems very unnatural and strange.
Yeah.
But when we think about how far we've come, Siri's talking to me, sorry. When we think about how far we've come, exactly as you said, as a physician, as an emerge doctor, I have seen vaccine preventable illnesses cause devastation and death. I've seen a child fighting with tetanus, and it was absolutely devastating. It wasn't here, it was in Southeast Asia. I've never seen a child in so much pain in my life, and I never want to see it again. It was absolutely terrible, and there was nothing more that someone could do for this child. I've seen measles, and I've seen measles kill people, and I've seen whooping cough, and children die from whooping cough in Canada. I've seen Haemophilus influenza, which is given in the tetanus vaccine. I've seen taking care of patients who unfortunately died of pneumococcal illness, which is in vaccines and is vaccine preventable and causes quite a few deaths in Canada per year. Vaccine preventable illnesses actually exist. They actually cause death and significant illness in kids in Canada. But if you really want evidence for this, Google polio, Google measles, Google smallpox. These illnesses, not smallpox anymore, cause significant illness around the world still. People still die from polio.
Yeah.
When people can't see it and they haven't experienced it, or they don't know anyone that died from it, it's hard to rationalize doing all these things that seem so foreign to them with vaccines. So I get why people are hesitant, but there was one single bogus study about MMR causing autism, one, and yet people still talk about it like it's dogma. And that is so crazy to me, because there's tens of thousands of studies show that it's complete and utter nonsense.
Yeah.
So yeah, it is a challenge to try to talk to families about how they are safe and they cause, people to stay healthy and well and alive, when people are like, oh, but whooping cough doesn't really exist anymore. No big deal. Oh, measles, it doesn't really cause illness in most people. Yeah, that's true. But when you have hundreds of thousands of people that get it, you absolutely have death. Measles killed tons of kids back in the day, tons of children. It was super contagious. Like, it really caused a lot of illness, like millions of deaths, in a lifetime. So yeah, it's hard to have those conversations. But what's interesting, like you say, about the COVID vaccine, if the COVID vaccine came out tomorrow, people would jump on it, even though it's new, not tested for very long. We don't know the side effects. We don't know like anything about it. People would be like jumping on it, even though COVID doesn't cause significant illness or death in almost any young people. And yet the flu vaccine exists. When COVID came out, flu was still killing young people in Canada at a much higher rate than COVID. It still kills many more young people than COVID does. Certainly COVID kills more older people percentage-wise, but influenza probably will always kill more younger people. And yet, I suspect if and when there's a COVID vaccine, young people will be getting it more than they will get the flu shot. That's my suspicion. And yet, influenza for sure causes more deaths in young people. So it's interesting. I don't know. It's the new kind of scary thing. And I hope we have a vaccine for COVID, but just to be honest about this and clear, it's not going to be for quite a while. I mean, it has to be developed. It has to be tested. It has to be effective. It has to cause no side effects. It has to be cheap. It has to be available to people, accessible around the world. There's so many pieces to making a vaccine. It's not a simple thing.
I've been saying that to people when people say, well, when it's ready. And I've said to them, like, you need to slow down because you assume, I mean, the likelihood is, yes, we probably will get to one, but there are researchers around the world that have said it may never even be possible. They've tried working on vaccines for coronaviruses in the past with very little success. Now, I think maybe the sense of urgency and everybody putting their minds together in the research community, I think maybe that's different than we've had in the past. So, I think I'm hopeful, but definitely I'm not by any means a sure thing. To me, I don't see that as like, well, that's 100% going to happen. And so, yeah, I think it really does highlight the point of we're spoiled, right? It's like you've said, if you've never seen it, you've never dealt with it. One of the things in my clinics, we deal with a lot of chronic pain types of patients, and we've seen people who are older that had polio when they were younger, and even just the physical things that you see as a remnant of polio is like, if anybody saw that, you'd be like, oh my God, I will do everything to try to prevent that in someone. We have patients with meningitis that have become paralyzed and have phantom like these things are real. These are not fake things. And I think that's the reality. And the unfortunate part is a lot of the world becomes sort of this echo chamber, right? Where, like you said, someone talks about one bogus study and that starts in a group and then someone else hears it. And that goes back to the idea of research versus just Googling something. And I think when you do, and one thing I really try to get across is, there are people that do this research, that look at all of the research in a topic and see if there's anything there. And over again, the real research around vaccinations shows nothing negative ever. It's only positive. There's only good that's come out of it. And there's no link to any things like that have been found, like, autism, obviously with that one bogus study linking MMR to autism. And if people, Google what happened with that study, the way they got to those findings, you'll be surprised at how unethical a researcher can be to get to their findings that way. So
but look at the power he has. Like, I'm assuming he never realized this would be the result, but holy cow, it's changed a generation of people that are scared of vaccines. All vaccines, not just that vaccine, but all vaccines.
I know, it's crazy. Now, what's with, and again, for a lot of, because especially now, I'm aware of vaccines, but in my practice, I'm not delivering them to young kids. And there's more vaccines than I remember having when I was a child. As an example, chicken pox and even potential ones for meningitis. As a pediatrician, do you recommend that children get every single vaccine that's recommended, even the ones that are, I think there are some that are not necessarily recommended, but highly suggested? What's your take on that?
What's on the routine schedule I recommend doing. Okay. There's some extra ones like meningitis B, for example. I don't typically recommend it. Most things that are not on the schedule don't need to be on the schedule, either because they're expensive or they have side effects or the efficacy is not enough that we'd recommend it to the global population. what's on the routine schedule, I absolutely recommend. And I recommend now too, this is a concern a lot of us
Yeah.
have, that if we're delaying vaccines because you don't have access to your doctor's not working, or you're fearful to leave your house and go to the doctor's office, when this is over, whatever that means, we're going to have a rush of people into doctor's offices, daycares, community that are under vaccinated.
Mm.
Could we see from this a rise of measles and whooping cough and meningitis? That is a real threat. So if you can access your doctor now and your child is young, like your child's age,
Yeah.
2 months, 4 months, 6 months, 12 months, 15 months, 18 months, they should be seeing their doctor if you have access, or find someone that is able to give the vaccines, because delaying those can lead to a lot of vaccine preventable illnesses. Again, things that are more likely to cause significant illness or death in your young person.
Right. Well, I mean, this has all been great information, Dr. Dina. Is there anything else that you can think off of the top of your head that you're very passionate about sharing, in terms of whether it's about COVID in general or just COVID as it relates to kids? Anything that I haven't asked you that you'd like to share?
We know how to prevent your child and your family from getting COVID. It's not a secret.
Yeah.
We know how to make the rates go down. Keep your hands really clean, show your kids, model the behavior of washing your hands well with soap and water, 20 to 30 seconds, multiple times per day. We know maintaining our distance of 2 meters is going to prevent the spread of COVID. We know how to prevent this. This is not a secret. Rushing back into normal life, I have a lot of concerns about that. I really do. And I don't think it's necessarily better for our kids' mental health if we then have to go back into 3 months of, quarantine again. No one's going to be happy with that.
No.
Patience here is key. And I think a lot of people are rushing back sooner than we should for, the sake of mental health, quote unquote, or the economy. The economy is not going to do well if we have another surge of COVID. Our medical systems are going to get bankrupt. They're already challenged. How many physicians are available to see patients? If we have more and more people getting sick, it's a big challenge on all of us. And I'm a business person, I'm a business owner. I understand the economic challenges to this, but rushing back is only going to set us backwards, I worry.
Yeah, 100%. I thank you very much, Dr. Dina, for everything you've provided us. For listeners and viewers, you can check out Dr. Dina on social media. You can also go to drdina.ca and visit her and find out all the wonderful things she does. I mean, your Instagram page is incredible. You provide a ton of information consistently about everything. And so I think it's great. I know, sort of, especially for new parents, even outside of COVID, it's a great resource for anybody. So I encourage people to follow you. I encourage people to go to your website, find out more about you. But it was a pleasure speaking with you today. And I thank you again.
You're welcome. Stay well, stay healthy.
Thank you.